Vulvodynia is a chronic pain condition that affects the vulva, the external part of the female genitalia. It is a condition that can be as isolating as it is misunderstood, and for many women, it brings with it not only physical discomfort, but emotional and psychological challenges as well. Understanding vulvodynia requires compassion, knowledge, and a willingness to break through the silence that often surrounds female pain. The term vulvodynia literally means pain in the vulva, but this simple definition belies the complexity of the condition. For most women, the pain is persistent, lasting for at least 3 months and often much longer. The pain can be burning, stinging, raw, or aching. Some women describe it as a constant throbbing, others as a sharp, knife-like sensation that flares up during certain activities, such as sitting for long periods, riding a bike, inserting a tampon, or having intercourse. For some, the pain is localized to one area, like the entrance to the vagina, while for others, it radiates across the entire vulvar region. The causes of vulvodynia are not fully understood. In many cases, there is no identifiable trigger or underlying disease. Researchers believe that several factors may contribute, including nerve injury or irritation, hormonal changes, allergic reactions, muscle spasms, or past infections such as yeast infections. Genetic predisposition may play a role, as can chronic inflammation. However, in most cases, no single cause is found. This uncertainty can be deeply frustrating, both for patients and their healthcare providers. Diagnosis can be a long and difficult journey. Because vulvodynia is a diagnosis of exclusion, doctors must first rule out other possible causes of vulvar pain, such as infections, skin disorders, or other gynecological conditions. This process often involves a thorough medical history, physical examination, and sometimes laboratory tests. Many women see multiple doctors before receiving a diagnosis, and unfortunately, some are told that their pain is all in their head, or that nothing can be done. For those living with vulvodynia, everyday activities can become daunting. Pain may be triggered by sitting, wearing tight clothing, or exercising. Sexual intimacy, which is supposed to be pleasurable, can become a source of anxiety, fear, or even avoidance. Relationships can be strained, as partners may not understand the extent or nature of the pain. The emotional toll can be immense, leading to feelings of isolation, low self-esteem, depression, or anxiety. Treatment for vulvodynia is highly individualized, as what works for one person may not work for another. There is no universal cure, but there are options that can help manage symptoms and improve quality of life. Pelvic floor physical therapy is often recommended, as it can help address muscle tension or spasms that contribute to pain. Topical medications, such as lidocaine ointments or estrogen creams, may offer relief for some women. Oral medications, including antidepressants or anticonvulsants, can help modulate nerve pain. In some cases, nerve blocks or even surgery may be considered, though these are typically last resorts. Lifestyle modifications are also an important part of managing vulvodynia. Avoiding potential irritants, like scented soaps, detergents, or tight-fitting underwear, can make a significant difference. Using soft, breathable cotton underwear and practicing gentle vulvar hygiene are simple steps that can help minimize discomfort. Stress management techniques, such as mindfulness, meditation, or counseling, can address the psychological aspects of chronic pain and foster resilience. Support is crucial. Women with vulvodynia often find comfort in connecting with others who understand their experience. Support groups, whether in person or online, can provide a safe space to share stories, ask questions, and exchange advice. Advocacy organizations play a vital role in raising awareness and funding research to uncover better treatments and, someday, a cure. It is also important to address the myths and stigma that surround vulvodynia. Pain is not a sign of weakness, nor is it something to be ashamed of. It is a real, valid medical condition that deserves attention and empathy. Too often, women are conditioned to minimize or ignore their discomfort, especially when it relates to sexual or reproductive health. By speaking out and seeking help, Women with vulvodynia challenge these harmful norms and pave the way for better care for all women. Healthcare providers, too, must be educated about vulvodynia. Compassionate, patient-centered care is essential. Listening to patients, validating their experiences, and working collaboratively to find solutions can make a profound difference in a woman's journey. Continuing medical education and updated clinical guidelines can help ensure that more providers are equipped to diagnose and treat vulvodynia effectively. Research into vulvodynia is ongoing. Scientists are exploring the role of genetics, the immune system, and the nervous system in chronic vulvar pain. Studies are examining new medications, interventions, and holistic approaches. The hope is that, as our understanding deepens, more effective and targeted treatments will become available. If you or someone you know is experiencing chronic vulvar pain, know that you are not alone. While the path to diagnosis and management can be challenging, there is help and hope. Reach out to a healthcare provider, seek support, and remember that healing is possible. Chronic pain does not define you, and with the right resources and support, you can reclaim your life. In summary, vulvodynia is a complex, multifaceted condition that affects millions of women worldwide. It challenges our understanding of pain, gender, and medicine. By raising awareness, promoting research, and fostering empathy, we can break down the barriers that prevent women from receiving the care they deserve. The journey may be difficult, but together, we can create a future where chronic vulvar pain is recognized, understood, and effectively treated.